getting hot here in southern Arizona. That means that snakes are out early this year. Here's a few things to keep in mind.
Rattlesnakes are reptiles and spend the winter times hibernating, so as soon as the temperature starts to warm up, that's when they become active. And usually the key to that is when the evening temperatures consistently stay above 50 degrees, they'll remain much more active, and so that's kind of their signal to it's summertime, it's spring and summer, it's time to go out and basically start their year. Traditionally what we see is that from April to October is considered the classic bite and sting season. Overall, the way we see it is rattlesnake bites from a disease standpoint is pretty rare. In Arizona, it probably affects a little over 200 people a year. But the reality is, as far as rattlesnake bites go, you are much more likely to be bit by a rattlesnake in Arizona than any other state in the country. It truly doesn't happen all that often, but when it does, it is incredibly significant and fairly traumatic. Some of the things that we try to educate people is that if you are bit by a snake, if you're bit by a rattlesnake, there is no first aid that we recommend. Anything you have ever seen in a movie, in a TV show, read in a book is probably wrong. It made for a great movie, but it's not what we recommend, meaning you do not cut and suck, you do not put a tourniquet, you do not tie anything off, you do not use ice, you do not use electricity. People have done a lot of things, anything and everything with this theory that I have to do something. But as it turns out, anything that anybody has ever tried to do outside of the hospital, so before they went to the hospital, either doesn't do any good or potentially causes more harm. Somebody's out gardening, doing yard work, taking the garbage to the curb, and the snake was under the garbage can, or reaching to get a golf ball out of the brush and the snake was hiding in the shade in the bush. So it's one of these classic wrong place, wrong time for a good number of our patients.
And that's exactly what happened to Dr. John Smith. Out on a golf course one day, he was reaching for a lost ball and was bitten by a rattlesnake.
So I walked down to pick it up, and as soon as I reached, I felt the snake bite and saw it. And I recoiled and looked down. I had 2 little drops of blood. So I walked across here to the green and shouted to the crowd here that I just got bitten by a rattlesnake. I obviously wasn't really aware of the danger. Since then, I've seen snakes and I realized they're really hard to see. They're camouflaged, they're on the dirt, they're dirt clay colored, and you can't see them. At the time it happened, I'm thinking, hey, this is Arizona. They know about snake bites, and I'll go in, I'll get some antivenin, everything will be fine. I wound up in intensive care for 2 days and proceeded to have all sorts of complications after that. I think the advice, what to do if you get bitten is important.
Anyone bit by a rattlesnake needs to be seen in the hospital as soon as possible. And once in the hospital, the poison centers can work with the physicians and nurses and pharmacists taking care of you to best optimize your care. And the only treatment that has ever been proven to be effective for rattlesnakes is antivenom.
My name is Jade Nunes, and this has been an Arizona Sonora News Service highlight.